Hi folks, I'm Dr. Michael Jones, President of the Medical Exercise Training Institute and the originator of the Medical Exercise Specialist Certification. We're back here for our second video talking about medical exercise training, the new modality. Now, we've talked about chronic medical conditions, but we've got some statistics here that actually give us a better idea of the impact that these chronic medical conditions have on our healthcare system. Now, currently it's 2019. Some of these statistics are 5 years old, and with that period of time being involved, we know that these numbers have significantly gone up. But we call this wasted billions. Now look at what we have here. Diabetes. It affects some 25.8 million Americans at a cost of $245 billion a year. Again, type 2 diabetes can be easily managed with diet and exercise. Hypertension affects some 67 million Americans at a cost of $93.5 billion. Again, it can be managed well with exercise as well as diet guidelines. Low back pain. We know 80% of Americans will lose at least one day of work as a result of low back pain during their lifetime. So when we look at the total cost of low back pain, it's estimated for the year 2010 to be $100 billion. Now, when we add surgical procedures such as laminectomy and spinal fusion, that number goes up about $15 billion. And remember, these are 2010 dollars. A structured progressive exercise program can help control some of these costs and also get some of these individuals back to a higher level of function with regard to their lifestyle, their work lifestyle, even some sports and recreation. Osteoarthritis. 409,000 hospitalizations occur as a result of osteoarthritis. Some 27 million Americans suffer from osteoarthritis, and this involves primarily the spine, the hip, and the knee. The annual cost associated with this is $89.1 billion. Now look at this last one, total hip and total knee replacements. This one blew me away. When we look at osteoarthritis, which results in the loss of function and is one of the primary reasons for total hip and total knee replacements, the number of total hip and total knee replacements respectively is 450,000 and 720,000 annually. That number is staggering. These individuals benefit tremendously from exercise with a structured protocol-based approach. Now you can see here, our healthcare systems are buckling under the cost of these conditions as well as draining the resources away. So with that, we have a mandate for change. The change in the healthcare insurance industries have mandated the use of exercise as a strong component in the medical management of some of these chronic conditions. There should be an actual integration of exercise protocols and guidelines into the healthcare management, but it's limited at this point. And medical exercise training is a new concept to deliver protocol-based exercise to clients that have these medical conditions. Now, the standard treatment process right now, folks, just doesn't work. And that standard treatment process from what we call the big five, the conditions we mentioned earlier, is usually drug therapy, short bouts of physical therapy or chiropractic care, and this offers temporary relief and some restoration of low-level function. But a structured protocol-based approach to exercise is probably the most effective thing we can do to manage these conditions and procedures. We must have the integration of medical exercise management into the healthcare system, and the importance of exercise is abundantly clear. The research is very clear out there. The integration of exercise in the medical management has been very slow to occur. And it's slow to occur because I think the medical community doesn't really know how to fit it in, but also I think the fitness industry isn't quite ready, doesn't have quite the level of training necessary to actually step up, sit at the table and take their place amongst the other professionals and understand their scope and role in providing exercise. And that's one of the things we've done with our medical exercise specialists and also here at the Medical Exercise Training Institute. MET components that should be integrated into the healthcare system with regard to medical exercise management include specific protocols and progression guidelines. That allows everyone to be on the same page with regard to what the exercise will produce. It doesn't mean it takes away from physical therapy or chiropractic or medical care, nor is utilized in lieu of those services, but it simply augments those services once that individual has been discharged. It also should utilize functional outcome measures as yardsticks to program effectiveness. Now, one of the key things we see sometimes in fitness is there's a tendency for the client to just keep going and exercising, but the exercise isn't effective. And yes, sometimes exercise can be ineffective if the program isn't appropriately established and developed for the client. And then lastly, I think one of the key things that we must do in the fitness industry is we must have communication and documentation systems to assure optimum results for the client, and communication of those results to the doctor, therapist, chiropractor, to the client, and even in some instances, the insurance carrier. The key to all of this is the integration of medical exercise into the management process of these medical conditions and truly understanding the role of the fitness professional in providing those services. Now, this concludes this video. We have another few videos that are in the series, but please, if you want to get more information on our medical exercise certifications, please go to medicalexercisetraininginstitute.com. We do know that the need for medical exercise training services will increase exponentially over the next 2 decades because of the baby boomers gradually moving into their retirement years. They want to do at 65 what they did at 45. And we know insurance carriers are reimbursing less for physical therapy and occupational therapy, chiropractic services, and we know exercise is the key to long-term management of most medical conditions. So you can see, over the next 2 decades, the need for these certification and these services will continue to grow. So thanks for watching this video. We'll be back with our next video where we'll talk a little bit more about the importance of medical exercise training. Thank you.